Thanks so much for coming this evening. I'm just giving you a heads up. We're going to start in about 5 minutes as a few folks are just trickling in on account of the weather. I also wanted to make another announcement that there's a car with license plate AMLP920 whose lights are on. AMLP920, your lights are on. We're going to start in about 5 minutes. Thank you.
Heather. Good, how are you? Love Heather. I haven't seen her in so
Hospital model.
We're excited to see where Niagara Health can go.
It's truly amazing. At Niagara Health, the key vision is by 2028, we will be a 3-site hospital. Our 3-site system will include 3 cornerstone hospitals, Niagara Falls, St. Catharines, and Welland. By the time we get to the 3-site hospital system, patients and families will have access to the highest quality clinicians for aging and wellness, stroke, cardiac, cancer, mental health, and women's and babies. And they will be treated in a very modern healthcare system where we have state-of-the-art equipment, state-of-the-art buildings, which therefore will have best outcomes and best care. Services will be much more connected than they are now because we will have up-to-date infrastructure as well as information systems so that patients and their families' information travels with them.
Culture is what Niagara Health is really made of. It's the opportunity for staff to engage with patients. It's the opportunity for them to engage with each other. Part of my job within our culture department is thinking about the wellness for our staff, the opportunities for them to feel like when they're coming into a building that they're taken care of and so that they can take care of others.
With focusing our resources at these 3 sites, we actually will enable better recruitment of staff, better retention of staff, and most importantly, best outcomes for patients.
I really wanted to become an ally on this project in order to help alleviate some of the fears in the community and start enhancing that conversation in different areas and ensuring that we are looking at the lens of not just process, not just policy, but the personal touch.
I'm glad that I became a patient partner. I'm glad that I was able to get behind the scenes and understand the decision making that Niagara Health makes. The decisions are made with a lot of thought, with a lot of engagement. As a patient partner, I was asked, I was listened to, and I was heard.
We want the region to feel and our staff to feel like we've considered how we can really support as patient care and also support staff to be able to do their best jobs every day.
Quality care is about people, not about a building. The future of healthcare requires access to family doctors and other community-based care providers. The Niagara Health System is working closely with communities affected by this change to provide new ways to access healthcare.
We are blessed to be able to have these centers of excellence coming to Niagara and ensuring that Niagara is taken care of as a whole.
We don't want to leave our communities to go and get care outside of the Niagara region. We want that care right in our own community. So for us to transform the way we're doing right now, we'll take those services, those specialty services, and bring them close to home.
We're going to get the best care possible. Hello, everybody. Can everyone hear me okay at the back? Yes, thumbs up. Thank you. Thank you so much for joining us today to hear us talk a little bit about the future of the Niagara Health System and to talk to us and give us your thoughts and opinions and ideas and concerns about the changes. And we hope we can have a great dialogue with you today. These plans have really been a long time coming, and I know that the plans for a 3-site model have been in place for a number of years. We were lucky to maintain momentum in the new build and the planning for that during the pandemic, and we were very happy to have broken ground on the new South Niagara Hospital last year. My name is Lynn Guerrero. I am the President and CEO of Niagara Health. I'm also a proud resident of Pelham. I've spent 36 years working in the healthcare system in various parts of the system, including government and agencies, and then frontline work, of course. I'm going to be joined on stage this evening by my colleagues. First of all, I'll introduce them. Angela Zangari, she's Executive Vice President, Finance, Redevelopment and Facilities, and Chief Financial Officer. And beside Angela is Heather Patterson, Executive Vice President, Clinical Operations. And lastly, Dr. Satish Chawla is Interim Chief of Staff and Executive Vice President of Medical Affairs. We're also joined by almost the rest of the executive team and many other members of Niagara Health in the audience, and some of our board directors are here also. So I would like to welcome you all and thank you to all of my team who's here tonight. I'd also like to thank some of our partners. So we do have a couple of people from the Ontario Health team here this evening. We have some primary care providers and we have Meredith and some of his team from the municipality. So this is the first of many sessions we have planned to get out and listen to the community and engage the community over the next couple of months in what we are calling our three-site hospital system. And we're very fortunate in Niagara that we are actually embarking on the new build of a new hospital a mere 10 years after the opening of the new St. Catherine's Hospital. I can tell you that there are many hospitals in the province that are just now embarking on redevelopments or new hospital builds, and they're quite a ways behind us. And given what's happened during the pandemic and the pressures hospitals are feeling, we're quite lucky to be ahead of the game with respect to new builds in Ontario. We're also in discussions with the provincial government about a massive redevelopment in Welland. We're just waiting to hear about a planning grant for that. And so we will not lose any momentum in getting to our strategy of the three-site model. So one of the good things about doing projects of this size is it really forces us to think through how we're currently delivering services across all sites and across all of the communities in Niagara, and to really do some planning ahead. And so that's why we're here tonight, to make sure that we're doing that planning, but the planning has been going on for about 10 years now. So we're all well into planning, but the changes actually do not take place for another 5 years. So we have 5 years to figure out, for example, what happens to the site here in Fort Erie, and I'm sure that there will be questions about that, and we'll also have that in our presentation. We also want to get your thoughts on our partnership. So we've been working quite hard with the municipality, with others in the community, with the provincial government and other healthcare partners in looking at how to make sure we're going to be providing high quality hospital care to the residents in Fort Erie and also the residents across the rest of Niagara, as we really work to modernize our healthcare system here in Niagara. And my hope is that we can have a really productive conversation today. We're really here to listen. And this doesn't have to be the last time we have a conversation with you. So this is the start of what is a 5-year journey to get to 2028. So before we jump into the presentation part of this evening, I would like to just pass things over to our moderator, Carly Ellis, who will provide a bit of an overview of this evening's presentation and discussion.
Hi everyone, my name is Carly Ellis, and I'm going to be supporting the presentation today, doing some moderation, especially as we get into that question and answer period. I also wanted to thank everyone for coming today, especially on account of the weather. It looks like it stopped snowing, which is fantastic. And I know we started a couple minutes late today, so initially we were planning on wrapping things up around 8, but I think we're going to extend a little bit to about 8:10, knowing that there's some questions and that we started a little bit late. We want to be respectful of everyone's time. Tonight's agenda, we are going to start with a land acknowledgement, followed by a presentation from the Niagara Health executive team. We're then going to proceed into that question and answer period that we discussed, and we're really looking forward to answering your questions. We ask that you save your questions until after the presentation. Many of you submitted questions in advance, and we hope that our presentation actually addresses some of those questions. When we do proceed into the question and answer period, we ask that you only ask one question at a time. There's many of you here, I'm sure you have many questions, and we want to give as many people an opportunity to ask their questions as possible. You may notice that the staff at the sign-in desk back here are distributing some cue cards where you can provide your input on what new community services could be provided in Fort Erie. As Lynn mentioned, we're looking to get your thoughts on that. So there's some cue cards at the back and on the side over here, and some boxes for you to put those answers in. All of those answers are going to be collected, and the Niagara team is committed to providing a summary and to making sure that we're taking into account what's been submitted. As Lynn mentioned earlier, we are hoping to have a productive conversation today about the future of healthcare in our community. So I am going to outline a few ground rules for today's session, and they're just on the board behind me as well. So first, we ask that you please maintain respect for the space and for others in the room. Please don't do anything that would prevent others from hearing whoever is speaking or cause unnecessary distractions. We expect that we're going to have about 45 minutes today to answer questions. And again, we just ask that each person only ask one question at a time so we can hear from as many people as possible. If you have a question, we're going to ask that you please raise your hand. We're going to have 2 mic runners in the room, and they're going to bring a mic to you and allow you to ask your questions. So you may have to be patient with us. It's a bit of a big room. We have 2 mics, so they'll come to you and you'll be able to ask your question. I'm going to announce the last question at 8 p.m. so that we can wrap up by 8:10 as we discussed. As you are asking your question, we'd ask that you state your first and last name before providing your question. I also want to note that today's session is being live streamed. We've got our friends here from Cogeco, and we just want to make sure people know that those who weren't able to make it out and are at home are able to watch the live stream as well. If at any point we don't feel as though folks are adhering to these rules or that maybe we're not having a productive conversation, we will close the meeting early, but otherwise we'll go until 8:10. I'm now going to pass things back to Lynn to give us a land acknowledgement, and thank you again for coming out this evening.
Thanks, Carly. So Niagara Health remains committed to highlighting inclusion as a key driver for providing high-quality care. We're committed to continue to listen and learn more about the history and current experiences of Indigenous peoples, and I acknowledge my own responsibility to take meaningful action towards reconciliation in the healthcare system. At Niagara Health, we really encourage our teams, instead of to just read the land acknowledgement, sort of reflect on what health and reconciliation means to them in their learning journey. So I just wanted to mention that one way I've continued my own journey of learning and reconciliation is to support the development of our very first Indigenous Health and Reconciliation Strategic Plan, which was created with input from many Indigenous leaders across Niagara and created by our own Indigenous Health and Reconciliation team that now works at Niagara Health. The plan will be launched publicly in April, and it will be in the memory of Heather Winterstein, a young Indigenous woman who died while in our care in 2021. So we believe strongly, and particularly as Canadians, we value our healthcare system. We believe that every person in our region deserves to live every day of their life in the best health possible. And as a community hospital system, it's really important that we focus on teaching and learning, research and innovation, and partnerships as we continue to improve those services as when people are ill and they require care. So it's really important that we have all of the infrastructure and the people and the tools and the innovation in order to continually improve our care. So in 2023, Niagara Health launched our new strategic plan, and the root of that plan is people. It's a pretty simple plan. And people means the patients that we care for and their families and caregivers. And people mean our teams, because without our incredible teams, we cannot provide incredible care. And central to this plan is designing a hospital system around the needs of our patients, their families, and loved ones. And that's for the entire region. Our goal is to make it easier for you and for everyone else to access high-quality hospital services and to improve your experience when you do so. So why are we evolving? So generally speaking, there are 5 key reasons why we feel that this plan is incredibly important to move forward with. And these challenges actually do require us to change the way we operate to meet the future needs of the community. So the first one is an aging and growing population. Our population is growing, and because it's also aging, the population has much more complexity in their healthcare needs than ever before. And this is creating pressure on our hospital system, and as a result, it might surprise you to know that we have one of the busiest emergency departments in the entire region, and that region is Hamilton, Niagara, Alderman, Grant, and Burlington. So for that full area, we're one of the busiest emergency departments. In fact, on many days, we are the busiest emergency departments. We also perform the highest number of day surgeries in the entire region as well. So as far as a hospital system, we're actually quite large in comparison to some of our neighbors. Even though we have this size of a system, our emergency departments remain very crowded, and we also are over capacity in our hospitals. The next reason is about team shortages. And you will have heard this in the media, you've probably heard me talk about it before. Like all hospitals across the province and across the country, we're facing critical shortages of healthcare workers, and particularly those who are trained to work in the emergency departments as well as our operating rooms. It's safe to say that we have shortages across every program of the entire hospital system, but those two areas are probably the most critical need. We're doing absolutely everything we can to recruit new team members, new physicians, new staff, and in fact, we've filled over 2,500 positions just between April and December of last year alone. So that's a 9-month period. So we continue to recruit, but we're also continuing to see people leave healthcare, we're continuing to see people retire, we're continuing to see people do less work perhaps than they did before. So rather than doing 10 shifts in the ED, an ED physician may say, I only want to do 5 shifts a month for going forward. Or instead of a nurse working full-time, she might say, I only want to work part-time going forward. So the pandemic, we believe, has taken quite a toll on people's ability to maintain that pace that they've been working in the past. And then a little bit about disconnected care. So we also need to evolve to create a more connected healthcare system and to better organize systems around our patients. It might surprise you to know that Niagara Health is still using paper records, and where we do have electronic systems, they are very outdated. This will be changed in September, so well before the opening of the new hospital, when we launch our new hospital information system. So we will finally have an up-to-date, modernized health information system to capture patient and clinical data. We also lack some specialty care at some of our sites, and often residents are confused about where to go for different healthcare needs, and we want to take that confusion away. Our staff and our physicians are also demanding a better connected system, and the health information system will go a long way for that, and then moving to the 3-site model will further connect the system. Outdated infrastructure. So our current sites here in Fort Erie, in Port Colborne, and Niagara Falls are quite old, and they're quite outdated and really beyond the point of renovation. We are constantly renovating and updating those buildings, but quite frankly, they're not really at the point of being feasible anymore. As well, our site in Welland requires a significant renovation or rebuild at this point in time. So we really do need to bring all of our facilities that we are going to work in into the 21st century, and the new South Niagara Hospital will be an immense help there. And the last thing I'll say is limited physical capacity. So if you've been to one of our sites recently, you will notice how crowded the sites are. We are operating well beyond our capacity limits. So our occupancy rate right now is typically around 115%. So a safe hospital typically runs between 80 to 90% occupancy, and we're running at 115. Our emergency departments are overcrowded. In recent times, in the last sort of respiratory season that we went through, we would have over 100 patients on any given day admitted in our emergency departments with no bed to go to. So we would literally have 100 people in our EDs who were finished their ED experience, but they required a bed, and we didn't have any beds to put them in. And that's why you see this backup in our emergency departments and the overcrowding that occurs. So we really do need to evolve and build new spaces so that we can accommodate this growing and aging population. And the time to do this is now, and we are really lucky that we have a plan that's been more than a decade in the making. I'll turn it to Angela.
Thanks, Lynn, and thank you to everyone for coming. And as Lynn mentioned, my name is Angela Zangari, and I'm the Executive Vice President here at Niagara Health. I'm a lifelong resident of Thorold, and I worked at Niagara Health for more than 30 years now. We've been making excellent progress against our Transforming Care plan and achieving our vision of replacing outdated, outgrown infrastructure with modern, state-of-the-art hospitals that will enable us to deliver truly connected care for all Niagara residents, regardless of where they live. And in order to do this and deliver the best quality of care, we need to focus our very limited resources and build seamless hospital care across Niagara with 3 cornerstone hospitals: the St. Catharines Hospital, now the Murata Family Hospital, South Niagara Hospital, and Welland Hospital. And as mentioned before, we anticipate that all services will transition to the 3-site model in 2028. So we're about 5 years away, so we still have a bit more time to prepare. In addition, our system will provide access to specialized care in areas including mental health and addictions, cardiac, kidney, stroke, cancer, complex care, wellness and aging, eye care, and maternity care. And while different sites will have their own areas of expertise, all 3 hospitals will work together as part of a seamless system of care. This means that a patient will be able to go to any Niagara Health site, and even if that site doesn't offer the services they need, they will be quickly transferred to the site that does. There will be no wrong door. The vision also includes strong primary and community care led by the Ontario Health Team and community-based health partners. So what do these changes mean for our patients and families? Patients and families will be able to access more care and services in Niagara with state-of-the-art facilities that have modern and connected technology, private rooms, more beds, and services. By building a new and modern hospital system will also help us to recruit and retain more expert doctors, nurses, and staff right here in Niagara. This means more staff providing care to our patients. And it will also help the region's recruitment effort as state-of-the-art hospitals are attractive to community physicians as well. The new hospital system also brings significant benefits to our staff and to our physicians. Modern hospitals are designed to the latest care standards and enable our physicians to overcome challenges to delivering quality care presented by the existing outdated and outgrown facilities. State-of-the-art technology and equipment will support our team members to practice to their full capabilities and expertise, therefore attracting top talent. And centers of excellence at our 3 cornerstone hospitals will drive quality across the organization and improve the consistency of care standards. Bringing together expertise and resources at all 3 hospitals will ensure our resources are not spread too thin. It will improve communication, connection, and support among our team members. And a modern regional system will allow Niagara Health to make the best use of the staff resources that we have, while positioning us to attract more talent in the future. Our community will have access to a specialized and seamless hospital system. Specialized care means that no matter which hospital you visit, you will be cared for by a team of experts specializing in the care that you need. Bringing together programs and services will create care, a seamless care environment, not only across the 3 hospital sites, but with our community partners as well. And bringing together our teams creates a collaborative and supportive environment that we have already witnessed at the Marada family. With our Women's and Babies Unit, and in the Welland Hospital with our Eye Care Center, and in Niagara Falls we'll be specializing in stroke care. That's something that I really want to emphasize for people. Quality health care is more than physical buildings. It's about access to modern equipment and highly trained staff and physicians. Everyone in Niagara knows the Walker Family Cancer Center is where to access the best cancer care in the region. Each of the 3 future sites will have similar specialized programs that will offer the best of the best our local healthcare has to offer. I'm going to turn it over to my colleague, Heather.
Thanks, Angela. Hello, my name is Heather Patterson. I am the Executive Vice President of our Clinical Operations at Niagara Health. Born and raised in Niagara Falls, I started my career at Niagara Health as a candy striper and have continued along the healthcare journey. I am a proud member of the nursing profession and have worked at various sites across the Niagara Health. To provide some context on the improvements to care in the future state of the regional hospital system, I'd like to introduce you to Mike, an example of a potential patient. Mike is a 74-year-old retired teacher who lives in Fort Erie. Mike is experiencing numbness in his face and has a severe headache. Mike becomes worried and calls 911. Our partners at EMS arrive at Mike's house and assess that Mike is having a stroke. Because of the partnership we have with Niagara EMS, they know that Mike should be taken to the Niagara Falls Emergency Department. Mike arrives at the Niagara Falls Emergency Department in 22 minutes and is seen by our dedicated stroke team. It is determined that he is a candidate to receive TPA, which is our clot-busting drug. Mike is seen by our regional acute stroke team at the Niagara Falls site, but is unable to be admitted to our dedicated stroke unit due to lack of beds. Mike still receives the best expert care for stroke and begins his rehabilitation. When ready, after discharge from the Niagara Health, Mike attends rehab services at Hotel du Shaver and Rehabilitation Center. In the new regional hospital system, EMS will take Mike to the new South Niagara Emergency Department. The new ED space can accommodate 92,000 visits yearly, an increase of over 20,000 visits a year. EMS and Mike arrive in only 15 minutes, and because of increased capacity in the new hospital, Mike is admitted to our Center of Excellence in Stroke, where he is surrounded by the most state-of-the-art equipment in a private room with the best clinical experts in one location. I'd like to hand it over to Angela.
Thanks, Heather. So where are we in the process to build this seamless hospital system? We're about halfway there. The St. Catharines Hospital, the first of our cornerstone hospitals, was completed in 2013. We just broke ground on the new South Niagara Hospital in June of last year. And finally, we are planning for the redevelopment or rebuild of the Welland site, pending confirmation of a capital planning grant from the province. So by the end of this process, we will have the 3 modern hospitals that will be Niagara Health. The South Niagara Hospital will transform the way we deliver care. It will have 469 beds, all private, increasing regional capacity by 156 beds. It will offer a full scope of hospital services as well as centers of excellence in complex care, wellness and aging, and stroke. It will also provide 21,000 mental health and addictions day services, 74% more capacity for MRI tests, accommodate 7,400 more seniors wellness visits, and include 12 additional hemodialysis stations. Our Welland site is one of our key cornerstone hospitals. Our transforming care plan for the Welland site includes 24/7 emergency services with 8 to 10 observation beds, complex care beds, a long list of outpatient clinics and surgical services, mental health and addictions, diagnostic imaging, kidney care, a center for excellence in eye care, and become the administrative hub for our team. And as mentioned previously, we are currently planning for the redevelopment of the Welland site and submitting a proposal to the Ministry of Health for their approval. This will include further staff and community engagement as well, as we want to hear from our staff in our community as far as what other types of services or clinics that we need or would like to be seen delivered at the Welland site as well. We are incredibly proud of our long-term care home in Welland. In March of 2021, the Ontario government announced that the 40 interim long-term care beds would become permanent and approved an additional 13 beds, bringing the total to 128 long-term care beds that is operated by Niagara Health. The long-term care home, much like the Welland Hospital, is outdated and requires redevelopment in order to meet the future needs of our patients and its residents. We are working very closely with the Ministry of Long-Term Care to determine how best to rebuild the long-term care and possibly add much more needed long-term care beds to the region. Together, we can rebuild a campus that is more than a hospital. The hospital itself cannot provide everything. A redeveloped site could also include preventative care by community health partners, a family health team, academic and teaching campus for Niagara College or McMaster University. Any unused land could be developed for senior supportive housing, could have an elevated transit hub, an Indigenous and spiritual healing space, or a community garden. The opportunities are endless, and it's something truly special that we can create together. Thank you.
Okay. So from the current Fort Erie site, the closest emergency department is approximately 22 minutes away. So we've sort of chosen the site as the point of measure in Fort Erie. 22 minutes away from the current Niagara Falls Hospital. So that's the drive time currently to the emerge. Our three-site model brings access to the hospital care and particularly emergency care actually closer to Fort Erie. Following the opening of the new South Niagara Hospital, all programs and services operated by Niagara Health will be transitioned from Fort Erie and Port Colborne and Niagara Falls to the new South Niagara Hospital and the Welland Hospital. By bringing together our limited resources across the three sites, the three hospitals will be able to provide more specialized care to patients by the best clinical experts, and I think you've heard Angela describe that well. The new South Niagara Hospital is built approximately 7 minutes closer than the current hospital in Niagara Falls, and it will significantly increase our emergency department capacity for the region. So you just heard Angela talk a little bit about this. The new emerge at the new hospital will be triple the size of the current Niagara Falls emerge, and it will be able to see approximately double the number of patients annually. So it is a massive increase in capacity in the new emerge. Now, we recognize that change will bring anxiety to those that are currently used to going to the urgent care center here in Fort Erie. But this transition of services will allow us to ensure patients are always getting the best hospital care. And we strongly believe that this is what is best for patients with respect to hospital care. So a little bit about the sites and the road ahead. In order to talk a little bit about this, I'm just going to talk a little bit about primary care. So access to family doctors and other primary care providers is very essential to a high-performing healthcare system. And the research on this is very, very clear. Access to comprehensive team-based primary care available to you when you're ill is the foundation to a high-performing health system. And this is this is across the world. It's not just in Canada or North America. This has actually been proven across the world. And we believe every Ontarian deserves to have access to comprehensive team-based primary care. And we know that Niagara region is underserviced with respect to primary care, and particularly team-based primary care. So we've been working with our partners in the municipalities as well as healthcare partners and the provincial government to expand access to community-based primary care services in the region, and very specifically in Fort Erie and Port Colborne. So following the opening of the new South Niagara Hospital in 2028, the municipalities will determine how to best use the sites in Niagara Falls, Fort Erie, and Port Colborne to benefit those communities. And we would strongly urge those municipalities to consider using those sites for primary care. And we are working really diligently in collaboration with those communities to try to advocate for expanded primary care in those communities. We, as the hospital system, have absolutely no oversight to primary care. However, we are advocating very strongly for that, and we've been working pretty closely with Mayor Redekop and his team on advocating and planning for a primary care health team to be at the site. The conditions for which people seek care at the urgent care center are conditions that are typically dealt with in primary care. And the episodic care you get at an urgent care center or a walk-in clinic is not the best care. And it's not care to keep you healthy. You also need primary care for your cancer screening. You need primary care to look at making sure your medications are up to date and that you have appropriate prescriptions. That's what Ontarians deserve, because that's the best care possible, and that's what we want to see in Fort Erie, and that's what we would love the hospital site to be used for. The other things it could be used for is diagnostic imaging, for example, in the community. You'll know there's lots of diagnostic imaging that happens in the community. It doesn't all have to happen at a hospital. So we would encourage and support and advocate for that, the provincial level with the government. So our vision is for the municipalities to support using the sites for community-run services such as I've described. Niagara Health will no longer be operating the Fort Erie and Port Colborne sites after the transition. And as mentioned, that's 2028. We still have 5 years to work out what will happen with those sites for the municipalities and strong advocacy with the provincial government to make sure that they understand the requirement for access to primary care. We very recently had a meeting that included the Mayor's office with Ontario Health. Ontario Health is the large provincial agency that oversees many health services on behalf of the government. They do have a role in making sure that communities across Ontario have access to primary care. So that is the group that has some accountability, and we're hopeful that they will continue to work with us on this, and we will absolutely be advocating very strongly for this community to have expanded access to that primary care that's so needed. We recognize that you'll have questions about this, and we absolutely look forward to those questions and doing our best to answer them with respect to primary care and the sites during the Q&A. Okay, we'll give it back to Carly. She's going to moderate the question and answer period.
Thank you so much, Lynn, Angela, and Heather. And we are going to move into that question and answer period. We are going to start with some specific questions that have been pre-submitted for today's session before we move into the live Q&A. So first of all, the first question that we received when we asked for questions from the community: what are you doing to ensure Fort Erie residents continue to have access to urgent care and emergency care? So again, this is a question that we received from the community, and I'm sure many of you are asking today. So I'm going to ask it again, and we're going to turn to Lynn to give us our first answer. So what are you doing to ensure Fort Erie residents continue to have access to urgent care and emergency care?
So I'll reiterate, can everyone still hear me? I'll reiterate some of the things I've just mentioned. So it's really important that all communities, but very important for you in the room, that Fort Erie residents have access to emergency care and hospital-based care, no question. We feel very strongly that the brand new hospital with modern infrastructure and amazing clinicians is the absolute best emergent and hospital-based care that this community could ask for. And it is closer to Fort Erie than the current Niagara Falls site. So we're feeling very comfortable that access to emergency care is going to be easier, closer, better, not overcrowded in the new hospital than it is right now, if you have to go to the emergent Niagara Falls. We've also mentioned that we're really going to be centralizing our services and consolidating our teams across only 3 sites, which really makes sure that you have a superb team that's looking after you in the right space, more privacy in the emerge, not overcrowded. So we're looking forward to that. And then, as I said, we're working with partners to make sure that Fort Erie residents have access to primary care services for the conditions that you currently seek care for in the UCC. And so that's a little bit of a reiteration of what I've already said, but anything to add?
Thank you. Another pre-submitted question that we received in advance of tonight's session: will you reopen the emergency department in Fort Erie and make the UCC 24/7 again?
So most of you will remember that back in 2009, Niagara Health, as well as the provincial government, made the decision to close the emergency department in Fort Erie, as well as to consolidate all of the acute care services from the hospital into the hospital site in Niagara Falls. So the Fort Erie site has not been a hospital with an emergency department for about 15 years now. Right. And that's not going to be changing. So in terms of the UCC, I want to talk a little bit about the second part of the question. We did have to make that very difficult decision to reduce the hours of the UCC, and I know in speaking to some of you and in speaking to the mayor that was very difficult for the community. I really want to assure you that was an extremely difficult decision for us to make and for our board to approve. And at the time, we were in a position where if we did not make that decision, we felt pretty confident that we were going to have to start reducing the hours and closing emergency departments. And that's something that is completely untenable in a region as big as Niagara, that we would actually have to start closing emergency departments. So we did have to reallocate from the 2 urgent care centers to maintain our hours of operation in our emergency departments. Very difficult decision, and I know it was difficult for the residents at the time, and probably still continues to be. I can tell you that given the shortage of health human resources, and very specifically the shortage of emergency trained physicians and nurses, we don't actually expect that to improve in the short term. We don't really see a time where we are going to be fully staffed in emergency departments for many years, which is really unfortunate and extremely stressful for all of us who work in healthcare and for the patients who are trying to seek care right now in our emergence. So we don't expect the hours in the UCCs to change, unfortunately, given that shortage.
Thank you, Lynn. Anything to add? Okay. Our last pre-submitted question, and then we will go to the live Q&A. How will transit evolve by 2028 when the new South Niagara Hospital opens so that residents can get to the new hospital?
So we had this question at regional council, and we probably should have had a longer conversation about it that night. Back in 2021, when the regional council was looking at regionalization of transit, or better regionalization of transit, Niagara Health did show up to make a presentation at that time to really urge the region to think through access to transit to all of our hospital sites, but most notably the new site, because that's going to be, right now it looks like a rural property, but once the hospital is built, that area is going to be built up. We are building a transit hub on the site of the new hospital, and so we have to make sure that we that the region delivers on the promise of transportation to the site. And we know that Fort Erie is uniquely positioned in our geography, we would say. And so we know that we've heard concerns about traveling to the new hospital if there was a snowstorm, for example. And we know that that happens from time to time. And sometimes so bad that you can't even travel locally. So I would say that during extreme weather events, our partners at EMS typically will up staff and make sure that they're prepared to deal with people who can't leave their homes. And we would have increased access to ambulances during medical emergencies. And so paramedics are very highly trained. They can do resuscitations. They're very well trained to deal with a medical condition once they arrive at your home or wherever you are. So during those periods of inclement weather where people don't feel it's safe to drive, it's really important in an emergency situation to call 911, which is what you should do right now without any change to the current system. It should be what you're doing now, but I would encourage people to continue